Heartburn symptoms. Heartburn occurs when a person finishes a large meal and begins to relax or fall asleep, causing chest pains that seem like the chest is on fire. Heartburn is a common occurrence that is usually minor and of little consequence. On a daily basis, many people suffer heartburn and a burning feeling along or just behind the esophagus. Heartburn that occurs regularly, even on a daily basis, is a sign of gastroesophageal reflux disease, a condition in which stomach acids and occasionally bile juices return up into the esophagus. Most people can live with heartburn discomfort by making lifestyle adjustments and taking over-the-counter drugs, but if the heartburn is severe, these treatments will only provide short or partial alleviation of the symptoms. Heartburn signs and symptoms. A burning sensation and pain in the chest and below the sternum are the first signs of heartburn. When leaning forward, lying on the back, or eating, the pain may rise and intensify. Heartburn might occur frequently and become more severe at night. Causes and risk factors for heartburn. The annular valve at the bottom of the esophagus, which is a ring of muscle encircling the lower part of the esophagus, opens during swallowing and allows food and drink to pass through it into the stomach before closing. Stomach acids may migrate up into the esophagus and cause heartburn if the valve opens on its own or if the muscle is weak, and acid leakage increases to the top when lying down or bending forward. Hiatal hernia and heartburn. Heartburn that occurs on a regular basis is a sign of GERD, though it can also be caused by other medical issues such hernias. When a hiatal hernia, also known as a hiatus hernia, forms, a portion of the stomach bulges into the space beneath the chest, and if the hernia is large enough, it can increase heartburn symptoms by weakening the valve at the bottom of the esophagus. Risk factors for heartburn. Many variables can contribute to the intensity of heartburn, including certain foods, such as fatty foods, spicy foods, chocolate, caffeine, onions, tomato sauce, ketchup, soft drinks, and mint. Beverages containing alcohol. Fatty foods. Sleeping immediately after a meal. Taking some medications to treat high blood pressure, such as sedatives, antidepressants, and calcium-blocking drugs. Tobacco use. Heartburn can be exacerbated by some disorders that induce digestive discomfort, such as 1. Being overweight. Excess weight puts extra pressure on the stomach and the diaphragm, which is the large muscle that separates the chest cavity from the abdominal cavity. This causes the valve at the bottom of the esophagus to open, allowing stomach acids to flow back into the esophagus, and may lead to eating fatty or rich meals. A similar phenomena occurs with fats. 2. Hernia hiatus. If a significant portion of the stomach enters the chest area, it may weaken the valve muscle at the bottom of the esophagus, worsening the heartburn. 3. Being pregnant. Pregnancy boosts the production of the hormone progesterone, which works to relax most of the muscles in the body, including the lower esophageal valve muscle. 4. Allergies. Although doctors have yet to demonstrate a direct link between asthma and heartburn, the cough associated with asthma, in addition to trouble breathing, may produce an imbalance of pressure in the chest and abdomen, as well as some asthma medications that widen the respiratory tract. 5. Diabetic complications. Gastroparesis is a consequence of diabetes in which the stomach takes longer to empty, and if the contents of the stomach linger for too long, they rise up into the esophagus, causing heartburn. 6. Gastric outlet is blocked. A scar, a peptic ulcer, or a malignant tumor in the valve area dividing the stomach and duodenum might cause a partial blockage. Stomach acids build up and run up the esophagus as a result of this. 7. Gastric emptying is delayed. In addition to diabetes and peptic ulcers, muscle or nerve dysfunction can obstruct gastric emptying, causing stomach acids to reflux into the esophagus, and some opioid medicines, such as antidepressants and antihistamines, can exacerbate the problem. 8. Defect in the connective tissue. Sclerosis, a disease in which muscular tissue thickens and swells, can cause the muscles of the digestive system to tighten instead of relaxing, causing stomach acids to back up into the esophagus. The Zollinger-Ellison syndrome is number 9. One of the side effects of this unusual occurrence is an increase in the production of stomach acids, which raises the danger of these acids backing up into the esophagus. Heartburn-related complications. Although most episodes of heartburn are temporary, prolonged or acute heartburn may indicate the presence of gastroesophageal reflux disease. Esophageal irritation and inflammation are among the complications of this occurrence. A small increase in esophageal cancer risk. Heartburn diagnosis. The diagnosis of heartburn is based on a detailed description of the patient's total symptoms in general. However, if the symptoms are severe and the patient's body does not respond to treatment, or if the doctor suspects the patient has gastroesophageal reflux disease or another disease, he may need to undergo further testing. A number of further medical tests are performed on the patient, including barium-based X-ray imaging, the endoscope, tests to determine the stomach's acidity content, heartburn relief. If the heartburn is mild and occurs only sometimes, the symptoms and accompanying phenomena can be relieved with over-the-counter drugs or self-treatment. The following drugs are available without a prescription. Antibiotics, H2 receptor antagonists, inhibitors of the proton pump. If you have persistent heartburn, it could be a sign of gastroesophageal reflux disease, which can lead to esophagitis. This condition usually necessitates the use of strong prescription drugs, as well as medical treatment and, in some cases, surgery. Preventing heartburn. Some lifestyle adjustments can help to minimize or even eliminate heartburn, such as: keep your weight in check. Avoid foods and beverages that aggravate symptoms. Dress comfortably slack around the waist. Eat fewer portions and avoid overeating. Quit smoking. Do not get constipated. Get enough sleep and manage your stress levels. Not falling asleep right after eating. In the bed, raise the head area. Alternative medicine. There are a number of over-the-counter drugs that can help with heartburn, but most only provide brief relief from the symptoms. Drinking water with soda powder or drinking soda mixed with water and tartaric acid are examples of these medications. Although these recipes temporarily relieve the symptoms of heartburn by balancing the acidity and washing it, they may aggravate the situation by adding excess gas and fluid to the stomach, which increases pressure on the stomach and then produces more stomach acids, resulting in an increase in acid reflux into the esophagus. The addition of sodium to meals raises blood pressure and puts more strain on the heart, while excessive digestion of sodium solution causes an acid-base imbalance in the body.